Okay, hello. Hello and welcome to the CAHOOTS Town Hall. Thank you for joining us here today on Kalapuya Ilihi. We are in a time of layered crisis, and your time, attention, and energy is extremely valuable. We really appreciate you taking the time to be here with us today. To learn about, appreciate, and support CAHOOTS. I'm Rori Rohlfs. I'm the Hildegard Lamfrom Associate Professor of Data Science here at the University of Oregon. In my lab, we do varying research projects from quantifying the accuracy of forensic genetic identification to estimating CAHOOTS diversion rates. This town hall was prompted and organized by Dr. Claire Herbert, who is an Associate Professor of Sociology here at UO and is unfortunately not here today. In the time between when we organized this event and tonight, when the event is taking place, CAHOOTS activity in Eugene have been completely defunded. CAHOOTS has gone from providing 24/7 crucial crisis intervention services to having no services in Eugene at all. Through the event tonight, we hope to bring light to what a colossal loss this is for our community. Today, we will be first learning about recent research that illustrates CAHOOTS' specific impacts. Second, we will be better understanding CAHOOTS' current situation in this crisis. And third, we will be discussing possible paths to restore CAHOOTS services here in Eugene. We'll start by hearing from two distinct research projects. First, Nathan Burton will talk to us about his efforts to estimate CAHOOTS diversion rates. Second, we'll hear from Elise Dandy Kohlauer about the results of her community survey about CAHOOTS. And then we'll be hearing from CAHOOTS itself as Michelle Perrin speaks about the current situation. After these three talks, we'll have a panel discussion where all of those speakers come up here and are available to answer your questions. So you should have received some index cards, and throughout the event, we encourage you to write your questions on the index cards so that we can then look at those and ask them to our panelists. At any point, if you'd like another index card, you can talk to one of our great distributors, Mahindra or Vanessa, and they'll also come around to collect them. So just flag them down so that we can get your questions. We really want to know your thoughts here. Okay, our first talk tonight describes research conducted in my lab by Nathan Burton. Nathan is a recent graduate of the University of Oregon program in data science. He has been conducting research on CAHOOTS since he graduated last spring, and previously he served 6 years in the National Guard. So without further ado, let's bring Nathan to the stage and give him a warm welcome. Here you go.
All right.
Pop this into?
Yeah, I'll figure it out.
Great.
All right, test, test, test. All right, it's good to go. All right, hello everyone, and thank you all so much for being here to support CAHOOTS. As all of you know, this past Monday marks the end of CAHOOTS services here in Eugene. I believe this is a terrible mistake, not only for the lives that will be impacted, though they will, but because it means walking away from one of the most effective and compassionate approaches to public safety in our entire country. I hope that today our research can leave you with a deeper understanding of the difference CAHOOTS has made in our community and evidence to help advocate for their return. So, one way to measure the impact of CAHOOTS is called a diversion rate. So when I say diversion, what do I mean? Well, put simply, a diversion happens when CAHOOTS redirects a call that otherwise would have gone to the police. This is useful because it helps us understand how many more calls the police would need to handle if CAHOOTS didn't exist. Now, to see this more clearly, I'd like you to imagine the Eugene Emergency Response System as this network of pipes. At the top, you see all the pressures that our community faces: mental health crises, housing insecurity, addiction, all represented as flowing water entering the system. Now, sometimes these issues escalate into situations that require police response, and when CAHOOTS handles one of those calls, we call it a diversion. So, in this context, when we talk about a diversion rate, what we're really asking is how many of these calls, or this flow of water, is CAHOOTS redirecting that otherwise would have gone to police response? Now, at first glance, it might seem simple to estimate a diversion rate. So if CAHOOTS is taking on calls that would otherwise go to the police, we can just compare the two, and that's our diversion, right? Unfortunately, it's not that simple, because CAHOOTS calls involve work that police would not normally do. A lot of them do, at least. So take emergency transportation, for example. That's not a typical police service, but it is a big part of what CAHOOTS does. So here's the key question. How many of those CAHOOTS calls are actually non-police services? And this is no simple technicality. Watch how dramatically our diversion rate can change based on how many CAHOOTS calls we consider to be these non-police services. It's a lot, right? So I'll go back to my question. How many of those CAHOOTS calls actually are non-police services? Unfortunately, there's no simple label in our data that can tell us. There's no box that says not a police call. So we have to be a little bit creative. Fortunately, there was a key event all the way back in 2017 that allows us to conduct an experiment. In 2017, CAHOOTS expanded their services to include the hours of 3 to 7 a.m. Before that change, police were handling 100% of the calls during those hours, which means that all of those calls were police responsibilities. So here's the idea. For call types where CAHOOTS was just taking over for the police, the number of calls should not increase that much. The calls are just shifting hands, so you shouldn't see that big of an increase. However, call types that do see significant increases likely involve some number of non-police services, and we can use that increase to estimate how many non-police services are being added to each call type. So if you'll recall our schematic from earlier, we are essentially using this increase following the service hour expansion as an estimate of how many non-police calls CAHOOTS is adding to each call type. So which call types saw these meaningful increases after the expansion? Well, we found 3, transportation, public assist, and found syringe. Each of these all saw statistically significant jumps, and each is predominantly handled by CAHOOTS. That tells us something important. These call types are likely new services outside of traditional police work. So using these increases as an estimation of how many CAHOOTS calls are non-police services, we find a diversion rate of around 17%. Now, I want to pause for a second because it's easy to lose sight of the human impact when we're talking about percentages and call types and numbers. But every single one of those 10,000 calls is a real person in a real moment of need where CAHOOTS was there to help. And because CAHOOTS was there to help, it meant that police officers had more time to focus on other calls. It meant people in crisis were met by trained mental health professionals, and our community was made that much safer. 17% might seem abstract at first, but it represents 10,000 real people that CAHOOTS helped. Now, CAHOOTS stepping in for police is a key part of how diversion works, but it's actually not the whole story. You may have noticed earlier that several call types also saw significant decreases following the service hour expansion. Calls like suspicious subject, dispute, disorderly subject, theft, even DUIs all saw significant decreases. So what's going on there? Well, let's go back to our riveting plumbing network. In addition to directly diverting calls from the EPD, CAHOOTS seems to play another role, preventing calls from ever happening in the first place. So CAHOOTS often responds to situations that don't quite rise to the level of a police call, but if ignored, that call could very easily escalate. Take a non-emergency transportation, for example. At first glance, this might seem completely unrelated to police work. But however, imagine that ride was for someone struggling with their mental health. Without that support, they could end up disoriented in a dangerous place, or even become combative with the public, and then suddenly that's a police call. So, while it's not a direct diversion, it's essentially a future diversion since it removes a future call that police otherwise would have needed to deal with. So how can we know if CAHOOTS is actually preventing certain kinds of police calls? Well, we used a method called clustering analysis, which is an algorithm that helps us identify patterns in our data. Now, this analysis revealed several important categories. Just to orient you on this plot, on the y-axis, we have CAHOOTS handling proportion. So basically, the higher you go, the more CAHOOTS handles that type of call. In green, you can see the call types that we looked at before. These are call types that CAHOOTS handled a lot. On the x-axis, you'll see the effect of the service hour expansion. So basically, the more right you go, the more CAHOOTS increased that call type, and the more left you go, the more they decreased that call type. So the key thing to notice here in the prevention category is that CAHOOTS had little to no direct involvement over these call types, but we still saw these statistically significant drops after the service hour expansion. Let's take a closer look at those call types. So we found this prevention effect in the following call types: disorderly subject, suspicious subject, and dispute. And that's important because these are exactly the kinds of situations you would expect to arise from unmet social needs: mental health struggles, substance use, chronic instability. Without services like CAHOOTS, people dealing with those challenges are far more likely to end up in conflict with the public or with the police. So while CAHOOTS certainly provides services that are outside of traditional policing, these services can still have very real impacts on everyday police work. Now, we've already discussed and shown that CAHOOTS is making a major difference. They handle 17% of all of the calls that would otherwise go to the police department. That's impressive, but it raises another important question. Could CAHOOTS be diverting even more calls? And that's not just a theoretical question. It matters because the answer helps us understand the true potential of expanding the program. Well, to answer this question, we look at something called the overlapping mandate. Now, that might sound scary at first, but what we're really doing here is we're looking at call types that both police and CAHOOTS regularly respond to. If you'll recall our schematic from earlier, we adjusted our diversion rates by removing calls that weren't typically police work. However, this leaves out a crucial point. There are many police calls we would never expect CAHOOTS to respond to. For example, CAHOOTS is never going to be chasing after bank robbers. I think we can all agree on that. So, bank robbers notwithstanding, there are obviously some police calls that we're not going to want CAHOOTS going to. So what we're doing here is we're saying, okay, we're only going to look at calls that either police or CAHOOTS could theoretically answer. So when doing this, we're looking at how many calls CAHOOTS is diverting out of their theoretical potential maximum. After running our analysis, we identified several call types that fall within this overlapping mandate. So the plot you're looking at right now shows how those calls are distributed between the EPD and CAHOOTS. On the far left, we start with all of the 911 calls within the mandate. These calls then either flow into CAHOOTS in orange or the EPD in blue, who address varying amounts of each call type. The thickness of each line shows you how often the call type happens. Now, there are a lot of categories here, but let's focus on the two largest: welfare checks and suicidal subjects. These are the most common shared responsibilities between CAHOOTS and the police, and as you can see, CAHOOTS is already handling half of these. That's a major accomplishment. But it tells us that there's also more room for CAHOOTS to expand. We would likely see significant reductions in workload for the rest of our emergency response system were we to expand CAHOOTS. Now, some of you may have heard that Lane County is rolling out a new mobile crisis response team. That might sound like it's a replacement for CAHOOTS, but it's important to understand that it's not a one-to-one substitute. And here's one key difference that you can see right now. Welfare checks are the single largest source of diversions in our entire system, and the Lane County model doesn't respond to these. Without CAHOOTS, all of these welfare checks will go directly to the police and will not be diverted at all. These situations involve some of the most complex and sensitive situations that our community faces, and their response really matters, and this is one of the reasons why we cannot lose CAHOOTS. When we look across all of the calls that either CAHOOTS or the police could theoretically respond to, we find that CAHOOTS handles nearly half of all of them every single year. This shows us that, again, CAHOOTS is already doing a significant amount of work, but could do even more if we gave them the proper resources. Now, I know that we've covered a lot of ground today, so let me just leave you with this. CAHOOTS makes a remarkable difference in our community. Right now, they divert around 17% of all dispatched calls every year, and that's a major accomplishment by itself. But our research also shows that CAHOOTS is still only diverting about half of what they could be, given sufficient support. On top of that, CAHOOTS isn't just responding to crises, they're actually preventing them from ever happening in the first place. CAHOOTS is effective, it's life-saving, it's smart policy, and it's a program that we should be expanding, not losing. Some may ask, and they may rightly ask this, how are we going to afford CAHOOTS? But I think the better question is, how can we afford to go without CAHOOTS? How can our community afford more stress on our police, on our firefighters, and our medics? How can we afford to reduce services for the homeless or for those on the verge of suicide? I don't think we can, and I don't think you do either. And that's why I'm so thankful for you all being here today to support CAHOOTS and to find out how we can save this amazing service. Thank you.
clarity there. Thank you. Thank you so much, Nathan. Thank you, everybody, for being here again. Our next speaker is going to be Elise Dandy-Color. Here we go. Who is a Master of Social Work student at Portland State University right now. They are currently conducting an employed practicum at Whitebird Clinic in collaboration with the CAHOOTS team. Dandy will speak about the results of her master's thesis research, including a community survey on the impacts of CAHOOTS. So let's give Dandy a warm welcome.
Hi, everybody. Thanks for being here. Thank you, Rory and Nathan. It's so meaningful and pertinent to the present moment in CAHOOTS history. So we are so grateful for all you've done for our team. Good evening, everyone. My name is Dandy. I'm a Master of Social Work student at Portland State University and member of the Teamsters Local 206. In collaboration with Whitebird Clinic and CAHOOTS, I'm going to present to you today the results of my practicum project, the CAHOOTS Community Survey. The purpose of this project is to assess CAHOOTS community impact in Eugene and Springfield and to engage in a meaningful dialogue about services with community partners. So as opposed to the publicly available data that was presented by Rory and Nathan, I'm going to be talking to you about the internal data. These are the CAHOOTS calls, the logs of each call we go on. And according to these records, in 2024, CAHOOTS handled over 16,800 calls for service. That's about 46 calls per day with 1 to 2 vans on the road at any given time. So we know that CAHOOTS services are in demand, but we also want to know why and what is the impact. In November, we launched the community survey and asked you, members of the community, what does CAHOOTS mean to you? Respondents were recruited through social media ads and email blasts to community partners and stakeholders. Over 540 people responded. As you can see here, more than 20 responses were collected from each of these 10 stakeholder groups. And the questions we asked included both fixed answer and open-ended responses. So along with the data, I'm going to be giving you some stories as well. Overall, our findings show overwhelming support and positive regard for the program. So let's take a look at those numbers. 94% of respondents agree or strongly agree that the program is an essential part of public safety. Here's some testimony from service users. A close friend of mine was informed about the suicide of a partner. CAHOOTS sat with her and helped her navigate informing her children. In such a chaotic scenario, the mother still praises the work of CAHOOTS to helping her manage this crisis with her children. CAHOOTS was always there for me when no one else was. During the hardest time of my life, they were ready to listen. They saved my life more than once. Here's another number. 78% of first responders who responded to the survey agree or strongly agree that the program benefits their department. Here's some testimony. CAHOOTS services have allowed our department to focus on policing and the fire department to focus on emergency medical response, while still keeping many of the most vulnerable members of our community safe. When I worked for ESF, CAHOOTS had a willing attitude to do things we and EPD couldn't. Everyone that calls 911 doesn't need a fire truck, ambulance, and 5 firefighters. Sometimes they need a connection, a ride, or a connection to a service. Sometimes they just need someone to talk to. Here's another biggie. 94% of survey respondents agree or strongly agree that CAHOOTS is a good use of tax dollars. Now, this is significant because previously, before the City of Eugene and Whitebird terminated their contract, the City of Eugene's reimbursement rate for the program was only about 40% of our operating costs, whereas in the City of Springfield, they are covering 100% of our operating costs, which is why we can continue to operate in Springfield now. So what makes so many of our respondents say the program is a good use of tax dollars? CAHOOTS is the leading provider of mental health crisis intervention in Eugene and Springfield. CAHOOTS is also an effective diversion tool, and also CAHOOTS are skilled and trustworthy professionals. Now I'm going to show you how we know that. Here's an example of the percent of the calls, the type of calls we handle. So over 73% of our calls are mental health. This accounts for over 10,000 individuals that we serve for suicide prevention, counseling, substance use, and resource referrals. 98% of the EPD and SPD personnel who responded to this survey, and those are the people that are on those acute calls with us, believe that CAHOOTS is effective at preventing suicide. Here's testimony from a dispatcher. As a 911 call taker, I had a call with a college-age girl on top of a parking garage. She was suicidal and looking for help. While police responded as well, what she really needed was immediate access to counseling. Everything about her tone changed when she learned CAHOOTS was on their way to help. I believe CAHOOTS as a program has saved people from suicide and helped prevent it from getting to that point for many others. Here's some stories from service providers. CAHOOTS is the most responsive and consistent organization in Eugene for help after business hours, late at night, and on the weekends. I've primarily used their services to help keep children home and safe through de-escalation. Without them, those children would probably be in institutions and legal systems. CAHOOTS teams have convinced no fewer than 3 of my clients who were suicidal to go to the hospital, and all 3 of them are still alive. Next, let's take a look at CAHOOTS as an effective diversion tool. In Rory and Nathan's presentation, diversions are defined a bit differently, as a percent of the public safety calls to dispatch that CAHOOTS diverts from EPD. For this project, a diversion is slightly different in that I'm reporting the percentage of CAHOOTS interventions that are assessed by workers to be diversions from another service. So these diversions are based on van workers' knowledge of dispatch protocols. This largest category, 36%, are the ones deemed not applicable. Now, a lot of these are going to be some of those preventative calls that Nathan referred to. So these are things like social service and shelter requests, welfare checks that aren't life-threatening, things that police and firefighters wouldn't necessarily respond to anyways. The highest category for our diversions, 30% of those calls are diverted from EPD. So things like traffic hazards or potentially life-threatening welfare checks. And the next highest category is EMS diversion. These are for non-life-threatening medical needs such as wound care, a vital check, or transport to a higher level of care for medically stable patients. And then we get down to hospital diversions. These are folks that were fully intending to go to the hospital and CAHOOTS was able to resolve their need in the field. And then arrest diversions, people in need of de-escalation or a change of scenery, such as disorderlies or trespassers. So in total, 64% of all CAHOOTS calls were defined as a diversion by CAHOOTS workers. So all those over 10,000 calls would have otherwise gone to these institutions who are not necessarily trained to provide the kind of services that folks are needing. Finally, look at some of our disposition. So at the end of a call, 73% resulted in people staying in the community. So that means CAHOOTS was able to resolve it on scene or taking them to a social service community-based facility. Only 9% of all the calls were transported to the hospital. And lastly, a look at perhaps why CAHOOTS is such an effective diversion tool. 89% of our respondents believe the program should be integrated health. That's mental health and physical. If we can have both, why would we not? CAHOOTS offers both mental health and medical services by workers who are credentialed as EMTs, QMHAs, and QMHPs. And this allows the team to make safe and informed diversions, as well as provide holistic care to the clients. Moving to the last point of evidence of why CAHOOTS is highly valued, I'll present evidence of why workers are skilled professionals. According to our call records from 2004, less than 5% of CAHOOTS calls resulted in a team requesting a backup response. So that means CAHOOTS workers are handling 95% of calls on their own. Now, this is in contrast to a recent study published in Psychiatric Services in March of 2025 that outlines how mobile crisis teams, the model Lane County is rolling out, that tend to rely heavily on law enforcement. None of the new MCT programs in this survey, in this study, showed a rate as low as CAHOOTS. "93% of service users agree or strongly agree that CAHOOTS workers upholds the program values." Here's testimony from a medical provider. "I just finished a shift as an RN. A patient admitted for medical reasons was about to leave against medical advice to check on a neighbor when I suggested maybe I could call CAHOOTS to check on them instead. The level of trust this person had in CAHOOTS was so precious." Here's testimony from some community members. "My experience of CAHOOTS is from the perspective of someone working at the library. What is incredible is the range of situations they can handle. What they can do is broad yet targeted and practical. The service they provide to this community is invaluable. As a high school counselor, I can call CAHOOTS and trust their judgment to work with my students in their most vulnerable moments. The workers always make a great team and honor that medical and emotional needs are often interlaced. They make my students feel seen and respected and help them choose safety. They are an invaluable resource for the community. There will be no other trustworthy and caring service as CAHOOTS." I have had a few opportunities to speak with van workers about the work they do. In every case, they have impressed me as people who do this work because they truly care about others and want to make our community a better, safer place for everyone. They face difficult situations most of us have never and hopefully will never have to face. I admire them for all the work they do. Next, what would make us better? 62% of the survey respondents said that CAHOOTS would be more impactful with more service availability. 67% of folks said they had trouble accessing CAHOOTS because of long wait times or limited service hours. Again, CAHOOTS is in demand. The community wants more vans on the road, not less. Here's a frequency-based word cloud we made based on a fill-in-the-blank question on the survey. Our community is blank because of CAHOOTS. The most frequent responses: safer, better, and stronger. Next, we asked people to describe CAHOOTS in 3 words. See if audio works on this. Oh, it's not going to work. Okay, that's okay. CAHOOTS is essential public safety. The community wants more of us, not less. What we learned on the survey is that you, the community of Eugene and Springfield, believe CAHOOTS is a vital service, and we have earned the trust of this community over 35 years as a leading provider of mental health crisis intervention in Eugene and Springfield. We need your support to keep the wheels on the road and our boots on the ground. We're worth it. One last number here. 90% of our survey respondents agree or strongly agree that the program aligns with their values. This reflects our respondents' desire to live in good fellowship with each other. With CAHOOTS' future being uncertain, it is essential that you carry that torch and keep the spirit of CAHOOTS alive in the community by extending that extra kindness and care to both our neighbors and to strangers in need. Thank you everyone who supported this project, and thank you for listening. I just want to say one more thing. I'm going to take my CAHOOTS or my PSU hat off for a minute and speak to you for just a second about as a member of Teamsters Local 206, the union representing CAHOOTS and other whitebird workers. I pursue this project every day I put on a uniform because I was always greeted by strangers who thank me and tell me CAHOOTS had a significant impact on their life. My hope in doing this survey was to capture a slice of that love that you show to us and put it into a story. When I began, I never imagined it would end like this. With the layoff of more than 80% of my team and the termination of our contract in the city of Eugene, there are complex socio-political factors that led up to this devastating event. No one person or entity can be blamed. Although this dismantling came as a sudden shock, it was years in the making. But I know in my heart that we as workers did everything we could to save our program, and we are committed to returning to work as soon as we find a way to do so. We stand by our values and bravely face bureaucratic and economic forces that prove stronger to us in this moment, stronger than us in this moment. But our spirit lives on, and I pray that this dark moment in history be an opportunity to build something else beautiful. Thank you. And next, we're going to hear from Michelle Perrin, licensed clinical social worker and CAHOOTS worker.
Thank you so much, Dandy. Thank you for the work you've been doing in the van. Thank you for the research work that you've incredibly done while doing the work in the van at the same time. And thank you for sharing that with us tonight. It was incredibly powerful to hear quotes from so many different community members. Next is indeed Michelle Perrin up here. Michelle is, like many people in CAHOOTS, both a licensed clinical social worker and an EMT with 27 years of experience in public safety and behavioral health. Prior to Monday, Michelle had spent the last 8.5 years working as a CAHOOTS crisis worker and EMT and clinical supervisor. Michelle's going to talk to us today about CAHOOTS itself and the current crisis. Thank you, Michelle. Let's give her a warm welcome.
Thank you. Thank you. Hi, my name is Michelle. What is your name? That's something that I have wanted to say because prior to Monday, I used to say that hundreds of times. I've said that thousands of times in my career. I am a licensed clinical social worker and an EMT who was laid off with my team on Monday. And we were invited here, kind of like what Rori mentioned, when we first started this project, this lovely project with Nathan, the lay of the land was a lot different. When we started to think about what are our challenges were very different. Even just a couple of months ago, what we thought our challenges were was figuring out how to diversify our funding, figuring out how we would go ahead and supplement our Eugene budget so that we could continue to provide 36 hours a day of care and 24 hours and get back to 24 hours a day of care in Springfield. We thought that our challenge was to figure out how to apply for and then access the Medicaid funds that were actually granted under the CAHOOTS bill. That's what we thought our challenges were. We were trying to figure out how we could do that while still honoring our public safety contracts. And so all we did was ask, hey, can we slow this down a minute so that we can make sure that we're going to honor our city contracts while we go after this new shiny thing? That seems to be the big thing that is funding things. So we thought those were what our challenges were, and that's what we were working towards. And then the challenges changed pretty abruptly when all of a sudden we got our team completely disbanded. The city of Eugene was abruptly, the contract was ended, and our community was blindsided by the fact that we weren't going to be in the community anymore, with pretty little information put out to explain what was going on. And I would just ask you to think about that for a minute. If we didn't know what was going on, can you imagine the vulnerable people who don't have the same access to information that we do? What that means to them? Many of them don't even know that that's what's going to go on. They're not going to know until they go to reach out for something that's been around possibly their entire lives, and they're going to be told, oh, they don't exist anymore. And just imagine for a minute what that would feel like when you're reaching out during a time of suffering and need and you're told that that thing doesn't exist anymore. So these are the challenges that we're standing here, facing today as a community. And so we realize the challenge now is in finding an exit ramp so that CAHOOTS' future is no longer tied to Whitebird's future. So what this includes is us as a team, the CAHOOTS workers who do this work, wanting to continue supporting the most vulnerable among us, being able to lighten the load and the legal liability of the public safety colleagues that we work with, and continuing a 36-year relationship with the city of Eugene and a 10-year relationship with the city of Springfield. This current challenge has actually become an opportunity for us. We want to move forward together and with our community. And that's why we want to speak to the future today. And instead of kind of discussing how we really don't know how the community is going to be able to show up for us yet. Like, we're still trying to figure out what that's going to look like. And so what we thought about was one of the biggest things that becomes a barrier for us is people don't really know what we do. Like when I go and we do, de-escalation trainings in the community, or when we're doing a lunch and learn with a business, partner, they're like, we didn't realize you did all of that. And so we thought what we'd like to do is use this time to educate you, to talk so that you can talk informatively about what it is that we actually provide to the community, especially if you're offered an alternative that you just are thinking, something's just not right here. And you'll be able to speak to that. So is that okay if we pivot a little bit? Okay. Before we begin, we do want to talk about some of the services that still exist, so that part of that education piece. So our HOOTS, our Helping Out Teens in Schools, which was born from the CAHOOTS model, that still exists within our schools. That is still being funded. It is still there. They still need community support as well as they battle Department of Education, funding gaps. You can see all of the school districts that the HOOTS workers are supporting our youth in. Whitebird Local Crisis Line still exists as well. And it has got limited hours, 8 a.m. to 8 p.m., Monday through Friday. And CAHOOTS in Springfield still exists from 11 a.m. to 11 p.m., 7 days a week. So that is what the current lay of the land is. So we've heard some quantitative and some qualitative data today. We talked about numbers and we talked about stories. And now we want to talk about, why does CAHOOTS work so well? Foundationally, we're rooted in transparency, we're rooted in accountability, we're rooted in community, and we're rooted in relationships. We have 36 years of experience that includes hundreds of thousands of interventions with the residents of this community. And no one else has that experience, the relationships, or the trust to do what CAHOOTS does. Big one to me, as being an EMT, and a big one to the community, is that we are integrative healthcare. Best practices show, and we have learned through years of experience, that you cannot separate physical and mental health. They can't be separated out. High blood sugar could look like mania. Low blood sugar might look like depression. Cardiac event, or possibly shortness of breath, it might be a panic attack. And when we look at the population that we serve, a lot of them have incredibly complex medical needs, along with their mental health needs. We're talking about people who have those mental health struggles, substance use struggles, people who are unhoused. There's going to be complexities in the population that live among us and that we are serving. For example, we may go out on a veteran who struggles with PTSD, but also had a recent amputation. So we're going to be able to do that wound care and also some grounding exercises with them. That's what makes it different. If you go to the hospital, imagine what it would feel like if somebody meets you at the door and is like, is this mental or is this physical? And you have to isolate that. And they're like, if it's mental, you have to go here. And if it's physical, you have to go here. Like, they're very hard to separate. You can't look at, especially with crisis, it's very hard to look at that in isolation. And so having a crisis worker and an EMT, we're able to treat the whole person with both behavioral health methods and community paramedicine. In fact, a number of the community paramedicine service, the fee-for-service billing, was designed in consultation with CAHOOTS and what we do. And that's a piece that is definitely missing from some of the news stories that you're hearing, a lot, some of the discussions around the loss of CAHOOTS in the community. Yes, we do the preventative things. We do things like transportation. But what you're also losing is a low barrier, non-judgmental, critical medical service in your community. We're also non-forced care. And what that means is, unlike law enforcement, we never use force to make somebody do something. We work with their will and not against their will. Our team has over 100 years of collective experience, and this allows us to meet people who are struggling where they're at. And often we meet them and we build relationships with them. We can often speak to that piece of them that they may not really know that, they know that they're struggling. They know they need help, but they're scared, and we can speak to that. For example, a family may call because somebody is experiencing a manic episode. And we can not only go in there and support the family, we can go and meet with that person, we can sit down with them, we can talk about what's going on with them, and we can learn how to kind of reach in and figure out, a lot of times people understand something's just not right. And so we can take that thread and we can keep building a relationship. And often what that ends up looking like, and it may not be that visit, it may be 2 visits down the line when we let people have self-determination. But often they're like, yeah, I do want to go to the hospital and see what's up with me. And that feels very, very different than it would if we went in, put them on a director's hold, and took them to the hospital. Got it. Yep. So we're also local. Our team is made up of Eugene Springfield community. Like our program, we're homegrown and intimately familiar with the resources available. In fact, I got to be on the team when a pair of CAHOOTS workers on their own time came out to Jasper Mountain where I was working because they just wanted to see what we did out there and they wanted to bring that information back. We're flexible and knowledgeable. We work alongside every system within the communities we serve, from alternatives like Black Thistle Street Aid to traditionals like law enforcement, fire EMS, and the hospital. We're a valid third arm of public safety. Our team has a culture of learning, and this leads to better client interactions and less burden on the system because we don't only utilize systems like the ER. And we've built a long-standing network of relationships within these systems which allow us to advocate and guide clients in whatever they need. We've built trust and rapport. The community trusts us. That includes our clients, local law enforcement, paramedics, local providers, hospital staff, and everybody in between. Through our hundreds of thousands of interactions, we have gained community trust. We've gained clients' trust by them watching us. We've gained officer and paramedic trust by them watching us. And we've earned community provider trust by them watching us. In an environment where safety and situational awareness and compassion are on public display, trust is not given, it's earned. And CAHOOTS has earned that trust. And one of the most important things, and why this work feels so sacred to me, is that we honor and hold space for people in their times of despair. We recognize there may not actually be an immediate solution to what they're experiencing. We can name something, be authentic, and be with them while they're struggling because they don't have to be alone. This honors their dignity and gets to the basicness of interconnectedness of human relationships. We can talk candidly with somebody. We can tell someone, there is not shelter for you tonight. You are going to sleep outside. And we can sit with them while they process that information. We can tell them what options may be available the next day. We can try to offer them some support, some basic gear. They don't have to be alone as they realize that they're going to be out there all night long on their own. But most important is we can sit with them and we can say, if you wake up at 2 a.m. and it's cold and dark and you're alone, you can call us and we'll be there for you. This work is important to us. It's important to the community. It should not be discarded when it becomes inconvenient to somebody's bottom line. So what is the future of CAHOOTS? Rising from these ashes to be independent and to rebuild a program that this community relies on. So we don't know what that looks like quite yet. We're still exploring. But we do ask, follow us on our socials. These are our socials. And we'll be posting updates as we figure out what that looks like for us to be able to show up for the community as CAHOOTS workers. Thank you.
Thank you so much, Michelle. Thank you for the work that you've been doing for our community for years and years, and thank you for your clarity informing everybody about the extremely wide range of services that CAHOOTS has been providing for us. So at this point, we're going to transition to a panel. I'm sure you all have questions after these three incredible talks. I'm hoping that you have your index cards and are able to write down your questions and pass them over to our students here who are collecting the cards. As you're doing that, I want to invite back up to the stage our three speakers who will be joined by Rori Rohlfs, who is also a licensed clinical social worker who has over 20 years of experience serving the Eugene and Springfield communities. Rori I'm devastated to say, Rori has not been laid off, that's good. Has been on the CAHOOTS team for over a decade, almost a decade, as a crisis worker and a clinical supervisor, and also works within our other public systems, serving middle school students and incarcerated adults. So let's have Laurel, Michelle, Nathan, Dandy, everyone come on up here as we're getting the questions together. So again, please give your questions to Mahindra and to Vanessa, who are walking around, and they'll be sorting those so that we can read them out up here. How do you do that? Oh, shit. Leave the pet slide up? Yeah, we can leave the pet slide up. Yeah, for sure. Thanks, buddy. Something else. Okay, thank you for your patience. We don't usually run town halls here. We usually do research and work in the van. Okay. Do you have any favorites? Okay, I'm going to ask some of the questions, and, we look forward to you all can respond. So our first question is, how did this funding crisis occur? What resources are currently available that best match CAHOOTS services?
It's complicated. I'm going to pass that. Oh, y'all, it's been a perfect storm. There were 3 kind of things that happened. As we know, the Eugene city budget is in crisis, and our community is facing a significant deficit. And though they covered 40% of our budget up till now, there's no guarantee that we were going to get any money from the city of Eugene in the new fiscal year. There were a couple of budget proposals, none of which included us. The alternative services kind of line item in the budget is one of the ones that has been tucked off to the side while we face this large crisis. So there's one piece. Second piece is that we've been talking a little bit about the Lane County Mobile Crisis Team. That is a certification that we are interested in getting. We would like to include the MCT in our services, and a lot of the work we do does fit in that pocket, but we really didn't want to compromise our values, and so we wanted to take that slow. We're not using those funds right now. We're not billing for our services. We're not using a fee-for-service model in this moment. And then the third thing is our clinic, and that Whitebird Clinic has really sped up the crisis. The current challenges when this flyer was made looks so different than this moment we're in now. So there's a lot of financial instability at Whitebird, and it is the choices of the clinic to, make those cuts. And so they made a decision to lay off 80% of our team, and the city responded by, severing that contract, which makes a lot of sense. I hope that's helpful. Oh, resources available. I remember part 2 of that question. Sorry. I think you heard about all of the things that we do, so I'm not entirely sure how to answer that succinctly, but I would say that the mobile crisis team for the county is rolling out. They have, they're available between the hours of 2 p.m. and 11 p.m., and they can respond to some of the services.
I think if I understood the question, it was about the resources that would support us. So we're definitely looking at what it would look like to be, able to bill fee-for-service so that we can bill Medicaid under the CAHOOTS Act. We're looking at diversification of funding. We definitely want to, have our contracts with the cities. We feel like we should be part of public safety infrastructure because that says a lot about the importance of our services. And then also private donors, we have national allies. We get some grants and trust money for, organizations that support the kind of work that we do. So we are looking at a wide, diverse funding streams, fundraising, all of this stuff. We are a nonprofit. Whitebird is a nonprofit at this point. And when we go independent, we'll be looking for those same things.
Okay, we have a bunch of great questions here. There's quite a few in this vein. I'm going to read 2 of them. Who do we put pressure on to renew a Eugene contract with CAHOOTS, paid for via taxes specifically? Similar question, what can we do to intervene and both hold the city of Eugene to account and to support CAHOOTS moving forwards?
When we look at a budget item, Eugene is going into their 25 to 27 budget year. So if you look at the city council meetings and the budget meetings that are coming up, that's when they're going to discuss the alternative responses. So that money should be going towards community safety stuff. There's also the Community Safety Initiative payroll tax that everyone in Eugene is already paying and is going to be paying through 27. It will be up for renewal in or actually not renewal, it'll actually go to the voters this time in 2027. So you'll have a lot to say about whether you want to keep supporting, if it's matching what it's saying it's doing, if you want to keep supporting that. So putting, pressure, just letting the city know that you still want CAHOOTS to be available for you, and that you know that CAHOOTS is dedicated to showing up, and we're going to do what we need to do to be able to shore up our staffing and be able to roll out to be able to help people.
I would just add to that, for the community safety initiative funds and that payroll tax, the charge of that, what they're going to be measuring is, how long did it take an officer to get to a non-emergency call? That's one thing. And then also, how many calls are just going to go unresponded to? I believe that currently it's about 40 calls a day that go completely unresponded to. So hoping to look at those numbers for the data nerds as of Monday. I feel like those numbers are going to change really significantly. So kind of watching this impact as horrendous and heartbreaking as it is, I think we're going to learn a lot about, the impact that not having us will have.
Okay, now a very specific question that I think a lot of people are probably curious about as we're thinking about CAHOOTS and the county service. What is a director's custody? Why does CAHOOTS not do them? And is the county mobile crisis service a police deflection model?
I can start us off with this one. A director's custody hold is a clinician-based hold, whereas a peace officer hold is put on by a police officer. The mobile county team has clinicians that are certified to do director's holds that they can access, the first responders can access on calls. We have similarly licensed people, but who have chosen not to become certified in director's holds. We believe that non-forced interactions are critical not only to our safety, but to any solid safety plan, right? Because people really need to be invested in their own plans. So building trust, having that force piece not even be a piece of the puzzle unless we absolutely need that because maybe someone is about to run into traffic. In which case, yeah, we will ask for that support. But we believe that the trust is really, really important. So there's the director's hold piece. Can you repeat the second part? Sorry.
Yes, I can. No problem. Is the county mobile crisis service a police deflection model?
Yeah, the word deflection, I know these words are so tricky. We're not even allowed to call ourselves mobile crisis anymore because the definitions have been made. Deflection, I think of deflection as currently there's deflection funding, right? In that Measure 110 repeal, there are deflection funds for officers to be able to offer a way out of a ticket that they might get for substance use. So I don't really think that the MCT is deflecting. I know we're here representing CAHOOTS, so I'll speak for us. I think we do a lot of work to try to prevent arrests and prevent people from getting in trouble, and we would continue to do that work if we could.
Just a little more context. I think that we're all happy to have more services out there. We can work alongside Lane County. We're stoked that people in rural areas can have crisis services. We're stoked that under our name, these services are available across the country. It's huge. We're so proud of that. The problem is, under that bill, they found a way to bill Medicaid. In order to provide these services, to fund these services, they had to make it behavioral health only. And that is not, it's a part of what we do, but it's not what we do. And so there's this intense political pressure for us to become that behavioral health Medicaid billing service. We need time to do that. We need to maintain integrity to our values. And that is the complex political arena that we're sitting in today. But what's most important to us is that CAHOOTS and Lane County are offered to our clients, and the clients have a choice. They can say they want CAHOOTS, they can say they want Lane County. For us, it's more about the choice that our clients have.
Unless you're 18 and under.
Right.
Okay, more questions about the future of CAHOOTS. Is CAHOOTS separating themselves from Whitebird? And if CAHOOTS did separate themselves from Whitebird, would that help bring CAHOOTS back in Eugene?
You can start. We have laid off and currently.
Yeah, it's complicated because so I took the resignation and Laurel chose to stay. So we kind of have base camp and behind those lines. So if we became independent, I forgot the question. Oh, are we thinking about separating? Absolutely. We are exploring an exit ramp to be able to not have our futures tied to Whitebird's future. We are looking for, we are, intentionally looking for a new fiscal sponsor, what that's going to look like, so that we can honor not only the money that has already been put towards what should be funding us, but anything that the massive amounts that people are saying, how do we support you? So we want to make sure that we do our due diligence so that people's money is safe and that it's going towards what you intend it to go towards. So high in the sky, Phoenix rising? Absolutely. We're hoping to be back to 24/7 in both cities as soon as we can.
Somebody is asking, can you offer a way to donate to keep CAHOOTS funded?
Yeah, we really ask you to follow those socials, the CAHOOTS and Hoots worker socials. We, most of us got laid off 4 days ago, and we want to be careful and we want to be diligent. We will, we've been working on trying to figure out pledging potentially, but we want to make sure that we have a good pocket. So we're hoping everyone will follow those socials so we can let people know.
Oh yeah, you can put that slide up again for sure.
There it is.
There it is. Yeah.
Yeah, get
Them's
that
the
QR
ones.
code. Okay, technical question for Nathan. What was your data set? Are you just comparing 2016 and 2017?
So basically our data comes from the CAD system. So every time a police call or a CAHOOTS call happens, it goes through dispatch. So it spawns a new call in the CAD system. So we basically got that data through a public records request. So we got all that raw data, we did some data cleaning. And then so for the service hour expansion experiment, we did only compare 2016 and 2017 because that's the data we had. But we are actually working on getting more data so we can hopefully get even more robust results and find out even more about that. So just stay tuned and we'll keep looking at it.
Including that we're pursuing very recent data since August, since the Lane County came online as well. If anybody was wondering, because I'm a data scientist, the discrepancy between Dandy's report of 16,000 calls and Nathan's of 10,000 calls, Nathan was only considering the calls that were within the police scope of service, not the calls that CAHOOTS goes on that are not within the police scope of service. So it's not, so the higher number is the total number of calls. We all agree. Okay, different question. How has Springfield maintained their service? Is their funding structure different?
Yeah, so the city of Springfield and the city of Eugene have two different city contracts. And so we were able to negotiate a contract with the city of Springfield that pays 100% of the operating expenses. So they were able to maintain that. Whereas the Eugene contract only paid 40% of the operating expenses, and without the ability to diversify funds quickly to make up the difference, that is why the city of Eugene disbanded.
and I'll just add specifically how that looked in our contracts, is the city of Springfield said, we have this much money for you. How many service hours can you provide with that much money? And we came back and we said, we can provide 12 hours of service with that much money. Whereas in Eugene, they were providing an hourly rate of service, an hourly rate per service hour that had been pretty much the same for years. And so it has slowly been less and less, lower and lower percent of our operating expenses as our operating expenses have increased. And the city of Eugene on our last negotiation was unwilling to alter the way that our contract was worded. So that is why Springfield has service now.
We have a couple questions about cost. I'm going to pair some of them together. How much does each EMS or police call/response cost? And then somebody else is asking something similar. What is the cost of an hour of CAHOOTS versus police, fire, or a hospital stay?
We're estimated at around, per Whitebird Clinic, we're estimated at around $120 an hour. I don't have numbers for police and EMS.
Is that per van?
That's per hour per van, yeah.
No, yeah. We can't speak for the other services, but some of us in this room have been to a hospital and are aware of the costs associated. More money questions. How much money would it take to fund CAHOOTS 24/7 service in Eugene? Similar question, what is the cost of maintaining CAHOOTS?
These are really hard questions for us to answer. And it does speak to the kind of widening gap between the program itself and the clinic. We just haven't had the kind of access that we would like to the budget, to the money pieces. So we can only really infer, you know. So we don't have all of that information to share with you tonight. And Whitebird Clinic, while invited, is not present to answer those questions for you.
So why didn't Whitebird or the city council show up?
We didn't ask the city council to come tonight. They would have been welcome. I think we alerted everyone we possibly could that we were hoping to gather and have a discussion that felt like authentic and sincere. We would love to do that. So if this led to a wider panel where we had more people from the city, we would welcome this conversation with anyone who wants to collaborate.
Okay. This is a note for you. Dear CAHOOTS, I cannot imagine working at Egan Warming Centers without knowing that you are there. How can I help this city to keep you? We need you. You save lives. Longstanding Egan volunteer from them.
Oh my God, you Egan volunteer, where are you? There's probably a bunch of you in here. Yes! So many snaps. So many church basements that CAHOOTS has been in with you talking about how do we do this work. You are in our hearts and will be showing up in all the spaces as we can.
Yeah, this is the most devastating part of this for me is not only our impact on our clients, but also our community partners, and that includes Egan volunteers, people at the library, businesses, for example. Like, this is gonna impact so many people, and it feels so bad to all of us that we can't be that reliable resource for those other folks who are out there trying to help. Yeah, that too. We have so much, a broad array of tools accessible that we can use and employ creatively to solve so many different problems. And we love being that type of resource, that type of multi-tool. So anyways, I am sorry, Egan. I'm hoping that we get back before next winter.
As we all are.
Yeah, and then just to add to that, like what I said in my presentation, we need the community to show up more. Show up for your neighbors, show up for strangers who look like they need help, and like do that work for us until we can get back out here.
And in turn, the community wants to show up for CAHOOTS and is asking what are ways that local unions, especially AFL-CIO members, can support CAHOOTS and the return of CAHOOTS now.
Do I need? Okay. Yeah, I mean, again, this moment is really dynamic, but we want to put pressure on the city. We want to stay in solidarity with our, like, 80% of our staff that has fallen away, and we want to get the vans back on the road. We need the city. We share assets with them. We ride in those vans. We have mobile technology. We have radios. We have a seat within the structure of the Eugene public safety community. So we really need that piece no matter what. So again, I'll just ask that people do consider letting their city councilors know, paying attention to the budget process, being as engaged as you have capacity to be.
Can I say something?
Please.
Yeah, so talking to your city council person makes a really big difference. Yeah, just find who that is and make friends with them. Just make sure they know your name and talk to them, and it really will make a big difference, genuinely.
Okay, related, and this is, perhaps a question as much for the audience as it is for the panelists. How many folks here are going to speak and share public comment at the next Eugene City Council meeting and let them know that we want CAHOOTS back? This is one of the things that we can do. Related, who within city government has been supportive to keep or expand CAHOOTS in Eugene?
I mean, I think that's another difficult question for us to answer, since we have not been the ones who have been communicating at that leadership level. So it's really hard for us to know who our allies are. The ones that we do speak to in confidence, I guess we can just let you know that there are definitely people that are speaking to us in confidence to share that they support us, and as soon as there is an active way for them to be able to participate, they're ready to do so.
When's the next city council meeting? Does anyone know?
When's the next city council?
Monday.
What time? 7:30 on Monday.
5:30, 7:30.
Put it on
Okay,
your calendar.
Monday, 7:30. Everybody can mark their calendars. We don't mind if you take your phone out and do that now. Okay, and I'll say we're still collecting questions. 5:30.
Monday, 5:30.
That's different, thank you. We're still collecting questions, so if you have questions, please pass them up here. We'll be excited to get through as many as we can in the next 10 minutes or so.
You have to sign up 30 minutes before to speak.
Thank you.
The city meeting, yes. 30-minute window?
Yep.
Okay.
Okay, people feel informed about the city council meeting? Okay, great. Has the team considered petitioning the city for a tax levy or ballot initiative to fund CAHOOTS explicitly?
Again, this is complicated. I think a lot of us feel like that's exactly what the city did with the Community Safety Initiative. We worked really heavily with them. They talked a lot about how important we were to the community safety pieces of Eugene. And we're very hesitant, especially right now, realizing times are tough. Like, I guess I'll speak for myself. So I would really like to see my tax dollars go towards the things that are important to me already. Like, we're already paying that tax, and I'd rather see the city divert that to what they said it was going to divert to, rather than say, oh, here's CAHOOTS again. Don't you love them? We've got this new thing. And so until we can really kind of get into the nitty-gritty of like where the CSI money went and how that's being spent in line with the values and how our name was used, we're just really hesitant to ask people to their love and their support and all that stuff, to ask for more money, because it comes from you. It's not going to come from the city. It comes from each and every one of you.
They sold the CSI on the back of CAHOOTS,
Yes.
and then they dropped CAHOOTS like a brick.
Sure seems like it.
It does. Our name and value is easy to use, and I think as our passion in this room and the CAHOOTS workers in the audience as well, like we are the workers of the program, so we have met and talked to most of the city of Eugene. I think we probably talked to more residents than any other program has. And so it's really easy for our name and value to be used. I think we need to be really careful and specific as we move through this process to make sure that if CAHOOTS is being named and mentioned, that everyone understands exactly what that's for. Because if you read through the ordinance of the CSI, it does specifically say that the money will be going to policing, community policing. So I just want to mention that. I feel like this process has taught me to be more careful and to be more aware. And as much as I am really not like a budget person, I'm getting more familiar with those pieces of the pie, because it has not served us to not be attentive to those things.
Okay, specific question here. Does CAHOOTS collaborate with ICE?
CAHOOTS does not collaborate with ICE. No. No.
Okay. More recent question that just came in. What is going on at Whitebird? Why do you see the future of CAHOOTS as separate from Whitebird?
Oh, y'all, what a question to drop on us in this moment. We have Whitebird to give our gratitude for the beginnings of our program and for keeping our program safe. But the last few years have really done a number on the clinic, y'all. It's been really, really hard. The pandemic was hard. It sort of severed our ability to be in community together, which is how we make decisions. We also grew exponentially. We had so many workers that came into work over the past few years, and it just grew really big. And the collective itself just sort of crumbled for, I believe, those kind of two reasons. And a corporate structure has replaced that collective space. And so if you go to their website right now, it's really hard to find really good information about this complete disaster that we're experiencing. And so I think like we just sort of have to interpret what has not been said, where the support has not shown up, where the emergency funds were not secured, where questions just haven't been answered. And we can say that we lost 80% of our staff prior to buildings being sold or other things. And we've definitely watched Eugene and Whitebird Clinics sever their contract that keeps us like attached to those assets and to be in community with you all. So I think we can kind of read between the lines, and it's sad. It's really hard. That's a really difficult place to be. And I think it's been hard for us to reach the community, and sort of one of the reasons why we were so thankful, so much gratitude to Rori and Claire and the University of Oregon is because it gave us an opportunity to come and have our voices heard. So really appreciative of that. Does anyone who got laid off want to speak to the clinic stuff?
No, I think
I did good. Okay.
Okay, a question about the event. Somebody is asking, several people asked if the presentations or their transcripts will be available online. That's not something I had thought about before, but we can make that happen if that's something that people would like. And we could probably post links on the social medias. No?
I know everyone just wants the pictures of cahoots and pets. I know.
Like 7 videos going too, so maybe pictures.
Okay, one person in the audience noticed that the Oregon State Legislature is currently in session. Are our state representatives doing anything to add emergency funding in the current legislative session to actually CAHOOTS?
No. And I don't think that's because of, like, we don't want to. The legislative session is focusing its efforts on civil commitment rights right now. And so while we've had like wonderful support from our senators, you know, Przansky helped stand up a lot of our trust in the community. Senator Wyden obviously deeply believes in the work and got that CAHOOTS Act. I think we do have representatives in government that care about CAHOOTS, the program, a lot, and have shown us that. And right now, the legislative session is focusing its efforts on civil commitment.
Okay, we are getting very close to time, so I want to ask our panelists if there's anything else that you want to make sure the audience hears tonight.
I think I want to name, like, although a lot of this is the focus on those of us who were laid off and how the program was reduced, that we do still have workers who are going to be out there in the street doing this job in Springfield. And so I really want to honor how difficult it is going to be. One of the workers has been with CAHOOTS for 21 years on the van. And so offer love to them, offer support to them, because they are still trying to manage this really difficult work in a really difficult work environment. And so I just want to name that because, like, our hearts are with them. We are all in solidarity with each other, and it's just a really difficult place for us all to be right now.
Okay. Let's thank our panelists. They have shared their blood, sweat, and tears here. A huge thanks to everyone who has made this event happen, to Claire, who is not here, to Mahindra and Vanessa, to everyone who's helped organize. We really appreciate your effort here. Thanks to everybody who's come to show their support to CAHOOTS. And I hope to see many of you on Monday at 5:30.